Hello everyone, so we are the group that is talking about the effects of stress on nursing performance, and we're going to be talking about our systemic review articles.
Okay, so mine is the impact of occupational stress on nurses' caring behaviors and their health-related quality of life, a systemic review. So nursing is perceived as a strenuous job, although past research has documented that stress influences nurses' health in association with quality of life. The relation between stress and caring behaviors remains relatively unexamined, especially in the Greek working environment, where it is the first time that this specific issue is being studied. The aim was to investigate and explore the correlation amidst occupational stress, caring behaviors, and their quality of life in association to health. So a correlation of study of nurses was 246 who worked at public and private units was conducted in 2013 in Greece. The variables were operationalized using 3 research instruments: the expanded nursing stress scale, the health survey, the caring behaviors inventory, and unvariate and multivariate analysis were performed. They had contact with deaf patients and their families. Conflicts with supervisors and uncertainty about the therapeutic effect caused significantly higher stress among participants. A significant negative correlation was observed amidst total stress and the 4 dimensions of CBI. Certain stress factors were significant and independent predictors of each CBI dimension. Conflicts with coworkers was revealed as an independent predicting factor for affirmation of human presence, professional knowledge and skills, and patient respectfulness dimensions. Conflicts with doctors, an independent predictor for positive connectedness. The conclusion was that occupational stress affects nurses' health-related quality of life negatively, while it can also be considered as an influence on patient outcomes.
Okay, I'll go next. So my article is called Interventions for Nurses' Wellbeing at Work, a Quantitative Systematic Review. So the aim of this article was to gather, assess, and synthesize current research knowledge on the interventions aiming to improve nurses' well-being at work. So the design of this article was a quantitative systemic review based on the procedure of Center for Reviews and Dissemination. So the method for this article was they used a systemic literature search that took place between 2009 to 2015 and conducted the following international database, which we know: CINAHL, Cochrane, EBSCO, is that how you say it? PubMed, PsycInfo, and Scopus. So while they were doing their research, the researchers focused on 3 questions. The first question was, what kind of interventions have been used to promote nurses' well-being at work? The second one was, what is the conceptual basis of the intervention, and what kind of measurements have been used for evaluating the interventions? So throughout their search, the researchers found 1,824 articles that were related to a nurse's well-being, related to their workplace. After exclusion took part, so this was if the study wasn't published between 2009 and 2015, if it wasn't English or Swedish, and if it wasn't targeting the nursing staff, it wouldn't be included in the research. So after the exclusion took place, they only had 24 articles left. And after that, they decided on their 10 that were more important to them. So the 10 articles described 8 studies on 6 interventions for improving nurses' well-being at work. 2 studies were done in Australia, 1 in the US, 1 in Canada, Finland, Netherlands, Israel, and 1 in Norway. The participants varied between 36 to 1,000 participants, and the interventions were carried out in public and private inpatient hospitals, mental health facilities, and nursing homes. So the 6 interventions were divided into 3 categories. 2 were person directive, 2 were combined, meaning there were person directive and organizational directed, and 2 were organizational directive interventions. So as far as results, the person directed one, they were divided into 2 categories, which were teaching methods of stress management and resilience building, and they produced statistically significant outcomes in psychological well-being and over the 7-month period. So they were taking classes that were 5 hours long, and they were learning new teaching methods about stress management. And after 7 months, they reviewed the results, and they significantly found that it was improving the well-being of nurses. So let's see. The most examined topic of well-being at work is still stress management. 90% of the interventions were. 90% of the interventions and all combined interventions produced significantly positive changes in stress and burnout. Any questions? I did like this article, but I don't think we still need it. I don't really think it goes with ours because it's focusing more on the well-being instead of actually how stress affects the performance of nurses. So, I mean, it was good in terms of interventions to use, but we're more focusing on like therapies and alternatives. So,
Yeah.
that's all I get.
Okay, so my article was called The Effectiveness of Aromatherapy and Massage on Stress Management in Nurses, a Systematic Review. So basically the background is we know that nurses experience an abnormally high level of stress compared to other careers. And it's related to factors such as work hours, staffing, shortages, heavy workloads, taking care of complex and dying patients, unsafe work environments, etc. So the article was basically saying that alternative medicine and therapies, such as the CATs that we're talking about in our project, are becoming more common in terms of ways to decrease stress. And they wanted to take a look and see how specifically aromatherapy and massage affect stress levels. And this is important because if it decreases stress levels significantly, then it should be implemented more in hospitals.
Which we're
Um,
trying to do.
Right, which is our evidence-based practice project. So basically the aim of this study was to perform a systematic review to identify, evaluate, and summarize studies of the effectiveness of aromatherapy and massage on relieving stress in nurses. Let's see. It was a quantitative systematic review using Cochrane methods. The authors searched literature databases such as PubMed, PsycInfo, Embase, and Web of Science, and Cochrane Library to examine any experimental design studies published from the earliest date available in August 2017, and they had to be in English. So that was an inclusion. And then they did a assessment of risk and bias. Exclusion criteria: there was no restrictions placed on the kind of essential oils used or dosage or length of interventions, but any article published before August 2017 and not in English were excluded. After they did the exclusion process, they originally had 1,088 studies, and then it narrowed down to 10 at the end, which included aromatherapy. There was 4, massage 4, aromatherapy massage, which is the 2 combined. There was 2 studies for that, and it was conducted across 6 different countries. And sample sizes from the studies ranged from 14 to 120 participants, adding up to 628 participants total from the 6 different countries. Average age 25.9 to 47 years old. All inpatient nurses aside from 16 outpatient nurses, and they were mostly all female, which it seems pretty common for all of our articles that in the studies that we've read so far. Due to the high diversity of the studies, including the design, interventions, instruments used to measure intervention effectiveness, duration of interventions, and length of follow-ups, it was determined that the meta-analysis was not feasible, and a descriptive analysis was used. And for the results, most studies reported that aromatherapy and massage exert a beneficial effect on the stress of nurses. One study showed that the aromatherapy massage with music intervention did not have an effect on nurses. However, the studies were biased and they were very limited. Let's see. Most of the included studies reported that aromatherapy was significantly effective in reducing stress. However, they also showed that not all of the nurses did experience lower levels of stress from these interventions. So basically the conclusion was that there was not enough evidence to prove that these interventions are effective. And basically because the trial and study sizes were just so small and all over the place, they used different techniques for all of them. So the author suggests that we do higher quality studies to verify the effect of the interventions and use larger study groups also. So I agree with that. I think it was kind of hard for them because a systematic review had not been done previously on this topic. But I believe that this article will overall benefit our project because this is pretty much what we're trying to do is implement
We're pretty
these
much
interventions.
doing the recommended.
Yeah, so
And we'll see that in combination with some other therapies.
right.
So I liked it. So mine's on actually one of the other therapies that we're going to try to implement, which is the mindfulness. So the title is The Effectiveness of Mindfulness-Based Programs in Reducing Stress Experienced by Nurses in Adult Hospital Settings, a Systematic Review. So the objective was to identify the effectiveness of mindfulness-based programs in reducing stress experienced by nurses in adult hospitalized patient care settings. The background, some of the newer stressors, because there's been stress affecting the nursing profession forever, since the beginning pretty much of the profession, but the newest stressors that we're facing today are related to staffing shortages, increasing complex patients, organizational financial constraints, and the increased need for knowledge with the ever-changing technology. So stress, as we already know from all the research that we've been doing, affects high-level cognitive functions, specifically attention and memory, which increases already high stakes for nursing. So the three main effects of stress that this article did a systemic review on were the burnout, depression, and lateral violence that occurs with the stress. So the design was a systemic review. The method was assessment of methodological quality. So papers were selected by 2 independent reviewers for the methodological quality prior to the inclusion in the review. They used standardized critical appraisal instruments from the Joanna Briggs Institute Meta-Analysis of Statistics Assessment and Review Instrument. The results, so the paper or the article broke down the depression, the lateral violence, and the burnout. And so they did systemic review on those 3 topics, and then they also did it on the mindfulness. So with the mindfulness-based programs, it showed that it's been proven to be a promising intervention in reducing stress experienced by nurses. The mindfulness-based stress reduction program, it's a combination of mindfulness meditation, body awareness, and yoga. If you weren't aware what that was. The practice is meant to facilitate relaxation in the body and calming of the mind by focusing on present moment awareness. So it was proven to be effective in reducing stress and increasing self-compassion in healthcare professionals. In a meta-analysis of the 7 studies conducted with healthy participants from the general public, because there aren't many studies being done on nurses, specifically at the hospital, so they did one in the general public, and the studies reported significant reduction in stress with the treatment and control groups were compared. So in conclusion, prior to this systemic review, there were no previous systemic reviews on the topic of reducing stress experienced by nurses through the mindfulness programs, which is why they did this review. In addition to stress reduction, mindfulness-based interventions can also enhance nurses' capacity for focused attention and concentration by increasing present moment awareness. So I think this article is relevant to the project because it provides evidence-based support to the implementation of the mindfulness-based reduction therapies that we want to incorporate in our mindfulness room.
That's good.
Any questions?
I like those 2.
I think our 2 are going to be good additions to our paper. So.
Thank you.
Thank you.
Thank you.